Good afternoon. I want to thank everyone for taking some time out of their busy day today to join me. My name is Fred Adams. I'm the Vice President of ColoHealth, and I'm here today to discuss 5 key facts that everybody needs to understand about Obamacare or the Affordable Health Care Act, whichever term you prefer, before 2014 arrives. And it's amazing to me, we're already into the month of December. It'll be 2014 in the blink of an eye. So let's go ahead and dive right in and make sure everybody's aware of everything they need to know to make the most informed decision possible for their health care needs next year. Now, I will say I currently have all the phone lines muted, so we don't have any background noise from anybody. Anybody that's watching the presentation online, you should have a chat box in your little Start Meeting control panel. If any questions come up during my presentation, you can feel free to go ahead and type them in the chat as they come to mind. Once I get done, which it'll probably take me 30 to 40 minutes to get to the end of today's presentation, once I'm done, I'll answer all the questions in the chat, and then from there, I will unmute the phone lines and take as many questions as we have time for over the phone as well. So getting back to the 5 keys that everybody needs to be aware of as 2014 rapidly approaches. I believe by this point, most people are well aware that the way health insurance works in this country is just about to change dramatically. If you've purchased individual health insurance in the past, you've been used to being asked a lot of questions about your health. An insurance company could turn you down if they wanted to. If they decided you were too much of a risk, they could put an exclusion on any pre-existing health problems you may have, or they could issue coverage for you at their standard or preferred rate. And as we move forward into next year, when you're applying for health coverage, you're not even going to be asked health questions anymore. Depending on what state you reside in, Colorado being a great example, you may be asked a couple of health questions, but those are really more trying to identify whether or not you would be eligible for some additional financial assistance via Medicaid, and doesn't really play much of a factor in whether or not you're going to be approved for your health insurance policy. But what is going to make a huge difference in what you pay for your health insurance policy next year, it's not going to be your health. It's actually going to be how much money you make. And as somebody that's been in the health insurance business, helping people get individual coverage for 25 years, I can say it's really been quite a different conversation that I've been having with my customers over the last several months, having to ask everybody how much money they make. So, since your health is no longer going to determine how you find the best health insurance policy for you and your family, I want to talk real quickly about the things that everybody does need to be considering. First, I will say what's best for me or what's best for your neighbor may not be the best plan for your personal situation. So one of the most important things everybody can do is take the time to determine exactly what it is you and your family would like or most need from your health insurance over the next year, and then take the time to work with an advisor that can help you find the best plan suited to your individual situation. And depending on your income level, you'll also want to check and see if you may qualify for any premium assistance, which would be money from the federal government that can help you pay for some or all of your health insurance premiums. Third key point, and I'll touch on this and illustrate this in much more detail a little bit later on, is everybody needs to really understand what a difference as little as $1 of taxable income can mean to you when you look at what you're going to pay, not just for your health insurance, but depending on your income level, also for your medical bills over the course of the coming year. And I'll show you a few tips and tricks here shortly of some ideas that we have that we are actually helping our clients lower their taxable income so they're able to receive more assistance in paying for their insurance premiums and in some cases for their medical bills as well. And this fourth point here, I think, is one of the very most important. You want to make sure that you're not just buying a policy based on the one that has the lowest cost or the lowest deductible. You really want to dig in and look and determine at the end of the year which policy that's available to me is going to leave me with the most of my hard-earned money in my pocket. So you want to consider what you're going to spend in monthly premium and what you'll pay when you're actually utilizing medical services over the next year. And one of the best ways to help make sure that you do keep your out-of-pocket cost as low as possible is to work with an expert, certified, licensed insurance advisor. And I know a lot of customers that I've been speaking with or people that have just been visiting our website before they talk to me, they mention they've already called Connect for Health Colorado, and a lot of them report that they haven't really had a great experience. If you happen to be somebody that's called that call center, you've probably observed that most of the people that are working there, they're just very basic customer service representatives. They're not even legally allowed to talk to you about how any insurance products available to you may actually work, let alone make any kind of recommendation on which policy is really going to be best for you and your family at the end of the year. So that's one reason I encourage everybody, whether you choose to get your coverage from ColoHealth or somewhere else, take the time to work with an agent that is licensed, that is allowed to help you figure out which policy is going to work best. And if you're going to be applying for coverage through the Connect for Health marketplace, make sure that the agent that you're working with is certified to sell on the marketplace so they can help make the enrollment process as easy as it can possibly be. So there's a few very important deadlines that everybody should be aware of, whether we're talking about changing coverage before the end of this year and not getting a policy through Connect for Health, or if you're waiting for a new policy that's going to start the 1st of January. Right now, we are in the middle of the very first open enrollment period in the history of this country for individual health insurance policies. Open enrollment started October 1st, and it's set to end March 31st. During that 6-month time frame, you're allowed to purchase any health insurance policy that's available. You're going to be guaranteed to get coverage as long as you're applying for a plan with a 2014 effective date. If you're applying for a policy that would start this year, insurance companies do still ask health questions and can turn you down or put an exclusion on a pre-existing condition. But if you want coverage to begin by January 1, you have to make sure that you've completed your application no later than December 23rd. And some of you, that date may sound different or new. The date was originally set to be December 15th, and I guess it was about 2 weeks ago that the marketplace pushed back the last day that we can apply for a January 1 effective date. And they're going to give us all an additional 8 days to get our application submitted. Now, even though you have until December 23rd, I'm encouraging everybody not to wait until the last minute. There's a number of reasons why. First and foremost is the simple fact that it's kind of human nature to procrastinate and wait and do things as late as possible. Knowing that there's going to be a flood of people trying to apply right before that deadline, my experience working with websites tells me that some people probably aren't going to get through. There may be crashes like we experienced in early October when the marketplace first opened. And anybody that's reaching out for the assistance of a licensed certified agent, there's only going to be so many of us to go around. So if you wait till the last minute, you may not be able to get the assistance that you need. And I'll also be talking about one other little delay in the process of applying for coverage in Colorado a little later in the presentation. That's another great reason you really don't want to wait until December 23rd. Now, for somebody that is maybe considering purchasing a plan that starts before January, whether you already have coverage and you're just looking to lower your rate, or if you know that you're not going to be eligible for a subsidy to help you pay for some of your premiums next year, and you know that rates are going to be higher next year than they are today if you have to pay the full cost of the premium, then I would encourage you to go ahead and shop for coverage now. You won't do that through Connect for Health because they're only showing quotes for 2014, but we do still have the ability to sign people up for new policies that start in December of this year. And as I indicated a moment ago, if you're not getting premium assistance, more often than not, you'll find a lot lower rate if you start your coverage today instead of the 1st of January. And if that is an alternative that you want to consider, you will have to have your application submitted no later than the very last day of this year, because once the calendar turns to 2014, it won't be possible to apply for a policy that started this year. So for those of you that are maybe interested in receiving subsidies or premium assistance to help lower what you will pay for your health insurance next year, there's a few things you should be aware of. First, the number that the marketplace is looking at when they determine how much of a subsidy that you may receive, it's going to be how much income you estimate you're going to make next year. And the vast majority of our clients are self-employed. And when I ask the average self-employed person, what do they expect their taxable income to be next year, it's led to some pretty interesting conversations because nobody that I've talked to yet has a crystal ball. So we don't know exactly what we're going to make next year. But in order to apply and qualify for any premium assistance, you have to take your best guess at what your taxable income will be next year. Now, at the end of the year, when you file your 2014 tax return, it's going to be up to the IRS to reconcile the entire situation, which means anybody that did receive a subsidy, they're going to be looking at what your income actually was, how much subsidy you received, and if you got as much subsidy as you had coming, or if you didn't get enough. And if you received more subsidy than you were eligible for, you could have to return the excess subsidy that you received to the federal government. And if you wind up making less money than you estimate and you don't take enough subsidy, then you would get the difference back on your next tax return as part of a tax refund. Now, the lower your taxable income is, the less you're going to see yourself paying for health insurance next year. And if you're an individual or a family and you're earning less than 400% of the federal poverty level, which for an individual, that's a little more than $45,000 a year. If you're a family of four, it's a little more than $94,000 a year. So if your income's less than that particular mark, then you may qualify for tax credits that can help you pay for some or all of your insurance premiums. And anybody that's at a lower income bracket, if you're making less than 250% of the federal poverty level, then you're also eligible to receive an additional subsidy that I find most people aren't even aware of, and it's known as a cost-sharing subsidy. And that's what I was referring to earlier, that would actually help you pay for some of your medical bills as well. And I'll show an example of how that'll work in just a moment. But before I leave this slide and go to a subsidy calculator that I want to show everyone a few examples on, I do also want to mention, if you decide to purchase a policy on the marketplace that is HSA qualified, which means it's a policy that allows you to open and fund a health savings account, Any money that you're placing into your health savings account lowers your taxable income, which can help you qualify for even bigger subsidies. I've actually worked with quite a few families where having the option of putting a couple $1,000s into a health savings account would either lower their taxable income to the point that they would be eligible for a subsidy, whereas if they purchased the non-HSA plan, they were going to make too much money to receive a subsidy. And then I've also shown other families how getting an HSA qualified policy, putting a little bit of money into that account each year, can help them qualify for the cost sharing credits, which for a family, it can actually cut what you would spend on your medical bills next year from $12,700 all the way down to $4,500. And there's nothing else out there like an HSA qualified insurance policy that gives you quite that degree of leverage when it comes to helping you pay the least money possible for health insurance and for medical bills next year. So I want to leave my presentation for just a moment, and I'm going to go to a subsidy calculator that I've been using to help our clients determine what kind of premium assistance that they may be eligible for. Now, if you run quotes on the Connect for Health website, it does give you the ability there to determine any subsidy you may be eligible for. For the first several weeks, I was noticing that their particular tool was giving a lot of inaccurate data. It's also a lot more difficult to create an account, log in, and actually determine any subsidy you may be eligible for than it is just to go to the site and run a quote. So this is the way that I've been going about helping my customers determine what kind of subsidy they would be eligible for. So I'm going to use the zip code 80525. That's Fort Collins, Colorado, where our company is based. We're going to be looking at a family of 3. I'm actually going to use my partner, Wiley, as an example here because he resides in Fort Collins. He just turned 50 this year. His wife, I believe, is 48, and they have 1 child. And here on this particular line where it asks you to estimate your income for next year, let's say Wiley was making a little over $78,000 in the coming year. Let's add $1 to that, $78,121. At that particular point, he's making $1 more than the federal poverty level. And we see here on this particular line, it shows how much subsidy that you would be eligible for. And somebody making even $1 more than 400% of the poverty level isn't getting any subsidy at all. So if we were to lower his taxable income by $1, maybe he got an HSA qualified plan and contributed to his account, we would see suddenly he would be eligible for a premium subsidy of $1,716 a year, which when you consider the fact that this family of 3 is looking at over $9,000 a year for their health insurance, a $1,700 subsidy, it helps some, but it's not as dramatic as what we'll see in a few of my examples here momentarily. So I'm going to lower this income down to around, let's make it $49,000. Same family of 3. So we see the same exact estimated cost for their health insurance. And at $49,000, this family's making 251% of the federal poverty level. And what we see suddenly is they're now getting a subsidy of $5,180. That's money that the federal government is going to send to whichever insurance company that this family in Fort Collins decides to purchase, as long as they're making their purchase through the state marketplace. And again, just to reiterate, even though you do have to apply for coverage through the Connect for Health site, you're allowed to work with any certified licensed insurance agent, such as the advisors here at ColoHealth, and we can help make the process as easy for you as it can possibly be. So it's at this point that I'm really going to start showing some even more dramatic examples of what a difference a few dollars here or there can make. So we're going to assume this family of 3 in Fort Collins purchased an HSA qualified plan, opened a health savings account. Let's say they put in $200. So that would make their taxable income $48,800. And at that point, they're making a few dollars less than 250% of the federal poverty level. Now, if you're following along, you see that their subsidy only went up about $100 to help pay their premium. Well, that's not that dramatic of a difference. They put $200 in their HSA. They got about an extra $100 of premium assistance. What's the big deal there? Well, when it comes to the premium assistance, that $200 HSA contribution isn't that big of a deal. But keep in mind, now that this family's making less than 250% of the poverty level, they're suddenly eligible for the second subsidy, and that's the cost-sharing subsidy. And if we scroll down the screen a little bit, when we get down here, and this particular tool starts talking about your out-of-pocket cost. If you're purchasing any bronze, silver, or gold policy on the marketplace, your insurance policy for a family, it can have an out-of-pocket spending limit of $12,700. So that means your family potentially could spend that much on medical bills before your insurance policy starts covering you at 100% for the rest of the year. Once you're making between 200 and 250% of the poverty level, you're getting a cost-sharing subsidy that's going to lower your worst-case scenario, lower the cap you would spend on medical bills to $10,400. So in this particular instance, this family putting $200 in an HSA to lower their taxable income to get down beneath 250% of the poverty level, not only are they getting $100 more to help pay their premium, but they're lowering their potential medical bills by $2,300. And that's a pretty good savings, but I'm going to change these numbers just a couple more times and make the example even more dramatic. Now we're going to drop their income to $39,060. We see at this point they're getting about $550 a month to help pay for their insurance premium. I actually meant to have $1 more than that. Sorry about that. And at that particular income, their cost-sharing subsidy is still limiting their out-of-pocket medical bills to $10,400. Well, when this family lowers their taxable income by just $1 more, they get it down to $39,060. Now they're making less than 200% of the poverty level. Their premium subsidy is about the same. Suddenly, their out-of-pocket spending limit, the most that family would pay for medical bills next year, drops from $10,400 all the way down to $4,500. So I know to a lot of people in the past, they have looked at an HSA and the fact that the policies have high deductibles, and to get any tax benefits, you have to actually put some money into a savings account, which that savings account's there to help you pay your future medical bills with dollars you don't pay any income taxes on. Well, I'm here today to let everybody know that considering an HSA offers you an option to have the ability to lower your taxable income that no other health insurance product would offer. And if you're somebody that's not close to one of these thresholds, whether it's 200, 250, or 400% of the poverty level, if you're nowhere near any of those lines, having an HSA may not give you as many options as it would some other people. But if you're anybody that's close, especially if you're going to be taking a subsidy to help pay your premiums and you're maybe concerned that you might make a little too much money at the end of the year and have to pay it all back, you definitely want to consider an HSA qualified plan because, as I said, it gives you options that you won't have otherwise. So back to our normal presentation. What can you do to make sure that you take control over your out-of-pocket spending on your health cost? And when I say your health cost, I'm not just talking your insurance. I'm not just talking what you pay when you go to the doctor. I'm talking about adding those two together and determining which policy at the end of the year leaves you with the most of your money, not giving it to a doctor or to an insurance company. And I know I've made this point once before, but I do encourage everybody to work with an expert advisor, a licensed agent that's certified to help you get coverage through Connect for Health. We can provide you with a level of advice that nobody in their call center is legally able to do. And if you do speak with an advisor, or if you choose to speak with an agent at another agency, make sure that you discuss with that individual what your biggest concerns really are. Is your primary objective to get the lowest premium possible? Is it to keep your choice of doctors? Or is it maybe to lower your out-of-pocket medical bills? And the reason that I stress keeping your choice of doctors here is the fact that about half the policies available on the marketplace in Colorado are HMO policies. And if you've bought a health insurance policy in the last 20 years, odds are good you probably had a PPO, which allowed you to see any doctor that you wanted. If your doctor was in the network, you paid less, but you could see a doctor that was out of the network. You just wind up paying a little bit more of the bill. Well, be very careful when you're shopping for a new plan in 2014 because HMOs are making a big return. And if you have an HMO, not only do you have to see your primary care doctor to get a referral if you ever want to see a specialist, but if you ever wind up needing medical care and you're out of network, you literally have no coverage at all. And from time to time, people will say to me, well, Fred, I don't travel much. There's a Kaiser facility just down the street. I'm perfectly okay with Kaiser. And for a lot of people, Kaiser works. It can be a very good company if you're comfortable with the HMO type of care. But I do always ask that individual to think for just a moment before they make that decision. What if you found yourself diagnosed with some kind of very dreaded disease? You know, you knew you had some bad form of cancer and you wanted to go and seek the finest medical care available. Maybe you wanted to go to Johns Hopkins or to the Mayo Clinic. Well, those particular providers are not going to be a part of any HMO that you may decide to join. And I did just refer to Kaiser a moment ago, and I will tell everybody Kaiser's been one of the 3 most popular plans available in the Colorado marketplace for the primary reason being for most people, it's the cheapest policy available. But what's the cheapest isn't always the best. So make sure if there's any doctors that you want to know accept your insurance, that you verify that they work with the policy that you're considering purchasing for next year. And I've talked to quite a few people that have told me they know their doctor takes Anthem Blue Cross or they know their doctor takes Humana. And when we look into the situation a little further, their doctor does accept Anthem and Humana if you have those companies' PPO plans. But if you look on Connect for Health and you're looking at an Anthem or Humana policy, they're HMOs, not PPOs. And those 2 HMOs are accepted at about 30% of the number of doctors and hospitals that accept Anthem, or Humana's PPO product. So getting an HMO is a great way to keep your costs down. It's also a way to make sure that you severely limit the choice of providers that you can see when you do actually need medical care. So again, just want to encourage everybody to make sure that before you make your final decision on which policy is going to be best for you and your family, don't just look at the lowest premium or the lowest deductible or the plan that has the lowest copay when you go to the doctor. Look for the policy that at the end of the year is going to keep the most of your money in your pocket. And that said, we're going to leave that presentation again, and we're going to jump over to Connect for Health for just a moment, because I want to show everybody a few things about getting quotes on this site. And if you haven't been to the site yet and you do decide to go and run quotes on your own without having an agent assist, I would encourage you to just hit Find a Plan and then use the bottom function here that allows you to browse for health plans without checking your eligibility. Because if you check your eligibility, you have to create an account, enter a lot more data, and just to get a quick feel for what quotes are like and what plans are available, this is the quickest, easiest way. And we'll stick with our zip code in Fort Collins. And we'll keep our family of 3. And then we're going to hit Browse Plans. And there's just a few things I want to show here, and then I'll go back and wrap up my presentation and start taking any questions. When quotes come up on this site, it's not the most user-friendly to actually read and figure out how the policy works. If you notice here, there's 59 different plans available for this family in Fort Collins. But if you scroll up and down the screen, you're only seeing 10 at a time. And the information that you see here is really pretty limited. You see the price, the company's name, the deductible, and what your maximum out-of-pocket spending would be. But you're not really getting any more details than that. You can also see what type of network it is. And if you see the word HMO, be very careful to make sure your doctor accepts that HMO or that you're willing to change doctors. And one other little tip I'll show real quickly, if you are shopping on your own on this site, if you use this provider lookup tool and you enter your doctor's name or your hospital's name, then it's going to eliminate any plans that your doctor doesn't accept, and that can make the shopping process much easier for you. But I'd like to know a little bit more about how some of these plans work. So let's just compare a few. We'll compare the cheapest one, and then we'll look at the first HMO. And I'll also go to the second screen. And I want to make sure that I look at a silver policy. And you notice all the policies we've seen so far next to the network, they indicate that they're bronze. The reason that I want us to look at a silver policy is the fact that the cost-sharing credits that I mentioned earlier, for anybody making less than 250% of the poverty level, you only get that cost-sharing credit if you are purchasing a silver plan. And I did not emphasize that thoroughly enough when I was discussing the cost-sharing credit. So just to repeat, if you're making less than 250% of the federal poverty level and you don't want your maximum out-of-pocket spending limit next year to be $6,350 for an individual or twice that for a family, make sure that you're looking at silver policies because those are the only ones that are going to give you those cost-sharing credits. So now that I picked a silver plan, I have 3 different policies that I want to compare. And if you scroll up here to the top, you can click on Compare 3 Plans. You can only compare 2 or 3 at a time. And look at this. This is hardly the first time I've ever seen this error message on this website. It's unfortunate that we got it during today's presentation, but we're going to try one more time and see if we can pull up the samples. because I do want everybody to have the chance to see what I wanted to show you. Now the site's not even going to let us back up to click Compare Plans. Let's try this one more time. We'll just do two real quickly. So I do want to move on and get to questions and answers in 5 to 10 minutes. When you compare 2 or 3 plans, this comparison first comes up. You don't really see much more information than you saw on the quote page. And if you try to get any more details, you can click on any of these categories here, and it'll show you how the policy works for whatever it is. Let's say testing. Testing, we see with the plan on the left, you would pay 30% after the deductible. With the plan on the right, you're going to pay a $500 copay after your deductible. But anytime you change from one category to another, the other category goes away. So this is not a very user-friendly way to compare plan details. And if you've been looking for a summary of benefits or more detailed information on these policies, you don't find them on this site. But what you can do, if you haven't noticed this yet, is go up where it says Download in Excel. And if you open up an Excel spreadsheet, then you're going to get a much more comprehensive explanation of how each policy will work. And the main things that I encourage everybody to make sure that you fully understand, it's this line 21 or 22, and that is what your maximum out-of-pocket spending will be for the year. Especially anybody that knows they're incurring a lot of medical bills, making sure you get the policy with the lowest spending limit is probably going to be more important to you than just shopping for the lowest premium. And in the name of time, that's all I'm going to touch on there. You could continue looking down the spreadsheet and you'll see copays for doctor visits, how prescription drugs are covered, and all the rest of the details. Now, let's get back to my last few slides so we can start taking questions shortly. This particular infographic was really very startling to me when I first saw it, but it's a great illustration of what my firsthand experience has been helping hundreds of families over the last few months explore their options for next year. And what we see on this infographic, this is considering 3 different scenarios, and in each scenario, we're making the assumption that the person is purchasing the second cheapest silver policy available in their area. And on the top, we see a family of 4, a couple of 40-year-olds, non-smokers with 2 kids, making $53,000 a year. If they were to purchase the second cheapest silver plan in their area, it's $962 a month. But based on their income, the federal government will pay $645 of that. So this 40-year-old couple with 2 kids actually winds up paying their insurance company $317 a month, which, depending on where they were purchasing their health insurance coverage previously, like in 2013, that same family of 4 was probably paying $300 to $400 a month, depending on what policy they had. Now, the next line's the real surprise. A retired couple. So we're talking 2 60-year-olds, also non-smokers, and they're living on a modest $25,000 a year. The monthly insurance premium for this couple is $1,365, and because of their income, the federal government's going to pay $1,271 of that, which is going to leave this 60-year-old couple paying just $94 a month for their health insurance. And I've talked to quite a few couples between the age of, say, 58 and 62 that have been absolutely blown away when they saw what they would pay for their health insurance, because they had gone and run quotes. They had seen all the quotes were over $1,000, in some cases a couple of $1,000, but they hadn't determined what subsidy they would be eligible for. And if they're making a fairly moderate income and they see themselves spending less than $100, or we've actually had quite a few clients sign up that wind up paying zero for their premium, then suddenly that couple, many of whom I've spoken with that were very against Obamacare at the beginning of our call, well, they suddenly see this new law in a whole different light because they see what it can do to help them. But let's look at the other side of the spectrum, and that's the healthy young 30-year-old. We've often heard them referred to as the young invincibles. They were expected to get health insurance because the law tells them that they have to, and they were going to pay higher premiums than ever before to help subsidize the cost of the older couples, as well as the unhealthy people who had been turned down for coverage in the past. Well, this 30-year-old making $30,000 a year, his monthly insurance premium would be $428. That same guy could probably buy a policy today starting in December for about $100. And based on his income, the federal government's only going to pay $76 a month, which leaves this healthy 30-year-old guy who probably thinks he doesn't even need health insurance paying $352 a month. Not only is he paying more than 3 times as much as the 60-year-old couple, he's paying more than the family of 4 as well. So, again, when I first saw this graphic, it was really rather startling because there's something about seeing things visually that for a lot of people makes facts sink in differently than it does when you just hear them. But this is a near perfect illustration of what I'm actually seeing working with dozens of people day after day after day. So what are your options going into 2014? If you currently have a health insurance policy, you're probably going to want to keep it if possible. And the reason I say if possible is depending on when you bought that policy and even which company you bought it from, you may or may not be allowed to keep it. I'm sure some of you are aware of the fact that the law says if you have a policy that was in place before reform was passed in March of 2010, your policy's grandfathered and you're supposed to be able to keep it forever. Well, we're seeing quite a few companies out there that are terminating all of their current business, even grandfathered policyholders. But if you do have a current plan in place and you're not eligible for a subsidy to help you pay for a big chunk of your premium next year, odds are you're probably going to be best served keeping that policy as long as possible. And if you have a non-grandfathered plan that you bought since the law passed, most insurance companies are allowing you to keep that policy through the end of next year. And if you're not sure how your particular company's handling that situation, of course your advisor at ColoHealth can answer that question. Or if you want to throw some at me, once I'm done talking here in a minute, I'm sure I could answer it too. Now, for anybody that is eligible for a big subsidy, or maybe if you need coverage on a guaranteed issue basis because you've been turned down before, or maybe you've been covered by Cover Colorado and they're terminating all their policies at the end of open enrollment, then you want to go ahead and sign up for a plan starting in January 2014. You're going to be guaranteed the coverage, and depending on your income, you're going to get help paying for some or all of the premium. And speaking of Cover Colorado, I have talked to some people that since they've received the letter from Cover Colorado that tells them the plan isn't terminating at the end of this month, they can keep it through the end of March if they want. And quite a few people have been considering taking that alternative just so they don't have to change right now. And I would say if you're thinking about doing that, whether you're covered by Cover Colorado or any other insurance company, keep this one fact in mind. Whenever you do change plans next year, if it's on April 1 because Cover Colorado ends, or maybe if you keep your plan and your policy terminates in the middle of the year and you think I'll just wait and change then, well, any bills you incurred when you were covered by that first plan after January 1, say until the end of March for somebody that keeps covered Colorado, the bills that you paid towards that deductible don't count at all once you finally change your coverage. So if you have covered Colorado and you're going to keep it through the end of March, just keep in mind when you start your new policy April 1st, none of the medical bills you paid those first 3 months count towards 1 penny of the deductible on your new health plan, and you're suddenly going to find yourself with a second deductible to meet next year and only 9 months to meet it. So for the vast majority of people, if you're going to be changing coverage during the course of next year, you want to go ahead and take action and get that new policy in place by January 1 so you don't find yourself having to pay 2 deductibles next year. And if you're somebody that's just saying, I'm not going to be forced into following any law or purchasing a health insurance policy that I don't want, I'll pay the tax penalty. You do have the option of going without health insurance next year, and for most people that opt to go without coverage, you would pay a penalty at tax time. Most individuals I talk to think that penalty is only $95, but it's actually $95 or 1% of your income, whichever is greater. And if you were making $9,500, $95 would be 1% of that. Then you're eligible for Medicaid. So I don't imagine there's going to be too many people out there that are only paying a $95 penalty. And my little tip here on my slide after I mention paying the tax penalty, if you are going to consider going that route because you don't want to be forced into Obamacare or you don't want to pay these crazy high new premiums, you might want to consider purchasing a short-term health insurance policy that you can keep for 6 to 12 months. You're able to get a short-term policy at a small fraction of the price of what you would pay for coverage next year if you're paying the full cost of the premium. And by having a short-term plan, you would at least give yourself some protection in the event that you were to develop some sort of disease or, heaven forbid, have some kind of major accident. And I know that I said earlier open enrollment closes March 31st, and after that you can't sign up for coverage again until November 15th of next year, which would start January 1 of 2015. Well, if you have a qualifying event during the course of next year, then you get a special enrollment period that gives you 2 months to change plans in the middle of the year. And qualifying events can be things like moving, getting married, getting a divorce, having a child, having a change in income, or if your health insurance policy terminates. So if you had a short-term policy, you had it for the first 6 months of next year, when that policy ends at the end of June, you have a qualifying event and you're able to have a special enrollment period to sign up for coverage in the middle of the year, if you decided that you needed to, instead of just renewing and getting a second short-term plan. So for those of you that do want assistance signing up through Connect for Health, I've already mentioned our staff here at ColoHealth. We can help you find the best plan at the best rate possible. We can show you how to possibly lower your taxable income to maybe get a bigger subsidy or to qualify for cost-sharing subsidies as well. If you do want our assistance, I just want to walk everybody through how the process goes, and then we'll start taking questions. After you've spoken with your advisor at ColoHealth and the two of you agree on which policy you want to apply for, we simply log in to our agent site on Connect for Health, and we send you an invitation that looks much like what you see on my screen today. All you need to do at that point is click on the link that accepts your advisor's invitation and names them as your authorized agent. And from there, we can help you get your application taken care of completely over the phone. We can do all the data entry for you and make this, what can be a very frustrating process, as easy for you as it can possibly be. Now, for some people, shopping online is very easy, especially if you've been dealing with your own health insurance for many, many years. Though I'll say this, I've been in this business 25 years, and for me, looking at different plans it's more challenging than it's been since very early on in my career because things don't work the way they used to anymore. So you do all have the ability to go and get quotes on Connect for Health or any other website on your own. But if you want to make sure that you stretch your hard-earned dollars as far as you can and truly get the best plan for you and your family, I would encourage you all to speak with a licensed certified agent. So once you have accepted the invitation from your agent for them to assist you with the paperwork, this next particular step is unique to Colorado, and it is causing a lot of delays, and it is causing a lot of people to get very, very frustrated. And in Colorado, as soon as you go to apply for coverage on Connect for Health, whether I'm helping you or you're doing it on your own, you get asked if you've been denied for Medicaid since October 1. And if you select no, then you get routed to the Colorado PEAK system, which is Colorado's Medicaid program. And I know some people that submitted their PEAK application the first week of October that make way too much money to qualify for Medicaid. To qualify for Medicaid, you need to make less than 138% of the federal poverty level, which for an individual is about $16,000 a year. And I've talked to individuals making $45,000 a year, and 8 weeks later, they still haven't been denied. And until you get your denial code from PEAK, you can't finish applying for your health insurance policy, at least not unless you're willing to pay the first month's premium in full right after you've submitted your application. So this is what I alluded to earlier when I said I was going to show you one thing later on in the presentation of why you do not want to wait until December 23rd to start this process and get your application submitted. Now, fortunately, the PEAK system did do an upgrade on November 21st. They say 80% of applicants are being denied in real time now, though I've yet to see anybody denied in real time. I think about 24 to 48 hours is the quickest I've seen. But until you have your 7-digit denial number for PEAK, you cannot finish your health application unless, as I said earlier, you're willing to pay the entire first month's premium and then let your subsidy catch up later on. So once PEAK has denied you and you get the 7-digit denial code, at that point your authorized agent can go back to your Connect for Health account. They can finish your health insurance application, transmit it to the health insurance company. There's actually a couple-day lag there before Connect for Health sends your application to your new health company. Once that happens, the insurance company has to mail you your first invoice. And the system was never intended to work that way. If you've bought insurance in the past, you've probably been used to submitting your first month's payment along with your application. And Connect for Health is intended to work that way, as is the federal website. But at this point, neither of those sites has finished building the payment system. So your insurance company has to mail you your first invoice in the mail. You have to get it paid by December 31st, or your coverage will not be effective January 1. Now, for anybody on the line that is a client of ColoHealth or you're considering becoming a client with ColoHealth soon, I just want everybody to know that I do hear that after the middle of the month, most of the insurance companies in Colorado, once they get your application from Connect for Health, they're going to allow you to call and make payment by phone, because with the last 2 weeks of the year and all the holidays and weekends, there may not be time for you to get your invoice in the mail and get it paid before December 31st. And if that doesn't happen, even if you applied today, you do not have health coverage the 1st of January. So, yeah, that's the process. I encourage everybody to know exactly what it is you want. Do you want your choice of doctors, the lowest cost possible, or the lowest medical bills at the end of the year, or a combination of all three? Once you know what it is you really want, speak with somebody that specializes in looking at these quotes all day long that can make the process as easy for you as it can possibly be. Any of the advisors at ColoHealth are thrilled to be of assistance. There's absolutely no charge whatsoever for our services, and the cost you pay for your insurance, it's going to be the same whether you go do it yourself or allow one of our expert advisors to make the process as easy as it could possibly be for you. So reach out, seek the help of a professional, get your application submitted as soon as possible, because the peak program may slow you down. The insurance companies can't take payments online yet, and January 1 is going to be here before we know it. And for those of you that do apply through our agency, we're making sure that we're following up on each step of the process every day, whether that means calling to peep to check to see if you've been denied before you get your letter in the mail, or having systems in place so that we notify all of our pending policyholders after the middle of the month of what steps they need to take to go ahead and call and make that payment by phone. So if you've already been working with an advisor, I would encourage you to reach out and seek their assistance as soon as possible. If you haven't, I'm sorry our toll-free number didn't make it onto my last slide here, but you can give us a call at 866-749-2045. That's 866-749-2045, and we will be more than happy to assist. So with all that said, I am about to look in the chat box, and we have a question from Nick asking if the government will be increasing the annual HSA contribution to keep up with the higher deductible policies. Great question, Nick. The HSA contribution limit is continuing to go up some each year. If you are a family policyholder this year, your contribution limit's $6,450. If you're an individual, it's $3,250. And next year, that amount's going up by $100. So families will be allowed to contribute $6,550, I believe, and individuals $3,350. And I'm sorry I said that with just a little bit of hesitation. Most years I have next year's HSA contribution on the tip of my tongue by the time December gets here. But to be perfectly honest, it's been so all-consuming preparing for and helping everybody navigate healthcare reform that I just haven't committed next year's contribution limit to memory as quickly as I usually do. But it is going up $100 or $150, Nick. Okay, let's see if we had other questions. Adrian, I don't really see a question, but you're very welcome. I'm glad to assist. I hope everybody's picked up quite a few tips. And Nick, I did see your comment that my time was up. I'm sorry I went a little bit long. I do get long-winded from time to time, and I definitely was trying to encourage everybody to utilize the services of an expert agent, whether it's ColoHealth or somebody else. I just want to make sure that everybody in the state of Colorado and every other state that we do business is really getting the best plan for their personal situation. And since most insurance plans are working different than they have in the past, and the representatives at the marketplace aren't insurance agents and can't tell you how the new policies work, I want to make sure everybody makes the right decision the first time, and especially be careful if you're going to consider an HMO policy. For some people, an HMO works great. For others, it can kind of turn into a nightmare. I think that's all the chat questions. Let me unmute the phone line. Okay, now we have the lines unmuted. If anybody does have any questions, maybe just let me know your first name so I know who I'm talking to and how can I be of assistance.
This is Mary.
Hi, Mary.
Hi. So if we have been told by our insurance company that we are good through December 31st, 2014, do we just kind of ignore all this and let it all fall into place and then jump into the game on November 15th? Is that when our open enrollment comes up?
That is when the next open enrollment would be. And for most people, I would probably 90% of the clients that I talk to, that's the best approach. Things are so different depending on several different variables. If you're eligible for any subsidy, you certainly might want to consider that. You may be able to get coverage cheaper next year than this year. Or if you maybe just want to look around to see, does it make sense to change coverage before the end of the year to get even a lower rate than your current plan? I am finding some people that are able to cut their premiums 10 or 20% by changing from one plan to another. So it really kind of varies on a case-by-case basis.
Okay, thanks.
Yes, ma'am. Anybody else? Well, I'll give one more chance. Well, if not, again, I hope everybody learned what they came to learn, got your questions answered. To anybody on the line that is already a ColoHealth client, thank you very much for your business. As one of the owners of the company, I appreciate each and every one of you. So whether you've already got your coverage set for next year, or maybe you're not a ColoHealth client, you're just looking for help, please give us a call anytime. It's 866-749-2045. And feel free to ask for me if you have any questions that you would like my personal assistance on. My name was Fred. I'm the only Fred here. And I hope to speak to many of you soon. Everybody have a great rest of the day.